The Central East Community Care Access Centre covers the Central East Ontario region spanning Scarborough, Durham, Trent Hills, Kawartha Lakes, Northumberland, Peterborough and Haliburton, and areas in between. Across this vast urban and rural area, there are 9 home-visiting palliative care nurse practitioners who provide care and support for dying patients and their families. In the spring of 2015, families, nurses, care coordinators, and nurse practitioners were asked to share their views about the nurse practitioner role in the care of the dying. The following are some of their responses.
You know, just knowing that somebody was there in our corner and that we weren't facing this alone, that, you know, she was in charge, and that was really important. Because the first time Michael was in the hospital, before he was palliative, when he came home, I felt like I was just adrift in the sea. You know, I really had no clue what to do. Knowing he was going to be dying within, I didn't think he would last a year at that point. He did wind up lasting another 1.5 years, but I didn't know how to access any help at all.
She's got such an advanced knowledge of assessment, certainly of medications. And it's just so, it's reassuring to the family. It's certainly reassuring to the visiting nurse to have someone to bounce your ideas off, share thoughts, share information.
It's been really key to making folks who want to die at home, it's been really a value-added service. It's saved a lot of trips to Emerge, because I find the nurse practitioners are excellent at telling people or informing people, you know, because they know the disease prognosis, they know where this is going, they know the symptoms that are probably going to be around the next corner, so they can inform the nurses or inform the family, like, this is maybe what you're going to see, so don't panic.
I think nurse practitioners are unique because they have that nursing background and that they really see their patient as a person. And they're, at least my experience with Franzis, she's not afraid to put her arm around Michael and to console him.
And we don't talk about dying. We pretend it's not going to happen. It's not going to happen for a long time, maybe, right? And then for Michael, there it was, right? It's something that was real, very real. He had a fairly long enough time to get his head around it, to be okay with talking about it, but he struggled with that, and people do, right? They try to ignore that it's happening. That's another, that's work that the palliative care nurse practitioner, all of us are very good at making it real for people, but making it okay, normalizing it, right? And then really making the rest of your life, or helping to make the rest of your life as good as it can be.
What we are taught as nurses, even in an undergraduate nursing program and as well as in the NP program, is that we are taught very well how to relate to patients. And I think that for most people, really, it is the relating element that allows that issue, that spiritual element, to be addressed. So we are open in our communication pattern. We ask questions. I think we feel and we reflect, and we are willing to go with the patient on a journey.
Also, the spiritual aspect of their care is important to some of my clients, because their spirituality has been part of them from when they were young, and I find that they cling to it more near the end of their death, and they want some more support around that. I noticed that a lot of them have some fears, and they need that. They're looking for that support. Because a lot of them, this is their first time, especially for family members as well. It's the first time with the experience being like experiencing the palliative care approach, and sometimes as well their first time watching their loved ones die. So they have a lot of stress, physical burden, emotional burdens. And I think when we talk about the spirituality piece, they seem to be able to care for their loved ones in a different manner.
It is definitely more difficult to deal with the impending death of a child. The discussions often are held with the parents, and we have to take that into consideration when we're dealing with these children, is that especially because the majority of my pediatric patients have been very young, so not at an age where I could sit down and have a conversation about end of life with them, so under 5. So parents are very much a part of that dialogue and actually will lead that dialogue in a lot of situations as to where they are in their child's disease trajectory. Have they accepted the diagnosis? Are they still looking for a cure? Where are they at? And we will often have to take our cues from the parents, although we are very much a part of that process of coming to terms with the impending death. I think it's so difficult because death has never been, for our society, a natural part of life, and especially for a child, when death is very much a natural part of life and should always be considered as such, even with a child, unfortunately.
We have a lot of additional medical training, and sometimes in order to achieve that caring, we need to get, in my opinion anyways, we initially focus on symptom management. We're bypassing that part of the job a little bit in our discussion here, because that's the simple part. Okay, so to get the symptoms under control, getting pain controlled, nausea controlled, skin issues managed, constipation issues managed, all those things are basic, but we can do that part. So we achieve that, we can get a little bit of control, then that moves on to the difficult part of the job, which is that healing art, the support. And I think families, they learn to trust us because they see that we can manage their loved one at home comfortably. So they learn to trust us.
I don't think that building trust is too difficult with families, because what we do is a privilege. We're invited into someone's home. We are there to help and provide what they need, to honor their wishes, and to work with them and their families in ways to find comfort and wellness in the setting of death. And we speak openly, we answer all questions honestly, we mediate and facilitate conversations between family members that are very difficult sometimes. And many people, when they come to that and realize that they have someone that can actually answer their questions and explain what's happening in the moment, and or prepare them for the next phase that's coming tomorrow or next week or next month, they understand that you're working with them, not against them. You're not holding things back. You're preparing them for the reality of life, which is actually death. And when you can prepare people for that and help them to come to an understanding that this is their reality, that actually provides them with a sense of relief. And it is a great gift to be able to give to families and patients, to provide them with their last wishes and make sure that we're honoring them.